Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right. I am John Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
It's a beautiful Wednesday morning, Marlene.
Yes, it is. It's hump day. We're halfway there.
Indeed. We're at midweek, and we're so glad that you're able to start your morning right with us. And as per usual, in terms of starting our morning right, we normally take a look at what's going on across our country and the news items that actually hit the news last night. There were so many news items. But as per usual, there are a few things that normally take the swing in terms of the most focus. And the most focus, and I think it's going to be for a while, and we're not necessarily a scratch record, Marlene, but it is the fact that we've detected variants in our country, COVID-19 variants. Mm-hmm. Now, there are things to worry about, but when you hear that Delta variant, which is very transmissible, and that is when it actually catches the attention of a lot of people, simply because we've been hearing about this Delta variant for a while. It was suspected that we had this variant that this variant was actually detected in the country, but they sent out tests and they actually came back positive. Yeah. Not only for the Delta, but for about 3 more, Marlene.
Yeah, that's right. We are officially confirming that there are the variants in the country. It had been, I think we'd all we'd all heard from medical professionals before that it was most likely the Delta variant that was circulating in the country. While I know the press release doesn't have the actual date, what we know is that these samples were not sent out recently.
No,
they
it
were
wasn't
sent,
recently.
At the very least over a month ago,
yes.
When they first detected the variants, and then they sent them over to Baylor College of Medicine. So these would have been positive samples from, I'd say, at least 6 weeks ago.
Yeah.
We can get the definitive date later today. So these variants perhaps have been spreading within the country since then. And we have confirmed the Epsilon, Alpha, Delta, and Gamma. Mm-hmm. And while, we're actually going to spend much of our show, we have Dr. Hidalgo and Dr. Musa coming in to explain what feels like an alphabet soup of variants, what's the difference, what it means, and what do we have to be concerned about. I actually wanted to hone in on something else. Yesterday's update from the Ministry of Health noted that there are 16 active hospitalizations.
Wow.
5 are in the ICU, and another family lost a loved one to COVID yesterday as well.
Yeah.
And I think when you put that into perspective, given the conversations that we've had with the KHMH, there are those who are confirmed COVID-19 that are in the hospital, and there are those that are suspected COVID-19 that are in the hospital, and they're treated like COVID-19 patients.
Yeah.
And I say that because they have to wait a couple days to get their PCR results. It still takes a bit of turnaround time there. So there are more than likely more people in the hospital than that 16. That 16 is just confirmed.
Yeah.
And let's look at what we had been told previously. Our capacity, as was reported a few months, 2 months ago, was 33 and 24 ventilators. Mm-hmm. So we are nearing capacity, if we're not at capacity
of the COVID unit.
For treatment for COVID-19. And that is a very serious situation because severe COVID requires extensive treatment. It requires, if you reach the point of intensive care, you may be intubated, or put on a ventilator really. Mm-hmm. You may require days and days and days of weeks in some cases of treatment. Yeah. So we have to take this serious. If the hospital is already at 16 confirmed, I don't know the number as yet of potential COVID cases that may also be hospitalized. We're at that critical point. We're at that point that we were trying not to get to.
We've been saying it. We've been preaching it. Like you mentioned, And I think we did so many times last week saying that we sound like a scratch record in terms of talking about COVID-19. But we're not just saying this because this is what we want to say. We're saying these things because it is the reality of what we're going through at this particular point. Alarming numbers, Marlene. We were once at about 32, 33 people, active cases. That's where we went down to. We're around 490 something right now. The numbers are alarming. Look at the numbers for new cases yesterday. And those numbers are 79 confirmed cases. Only 42 recoveries. Now, within the country, we've got 400 and something cases active of coronavirus. Belize
Confirmed.
City, confirmed cases, yes. Belize City continues to see double digits on a daily basis. Yeah. I think about 31 for yesterday, if I'm not mistaken, and I'm sure that's coming up in just a few.
Yeah.
But it simply says, Marlene, that we feel like we're relaxing. We're just taking this thing like it's nothing, and it's clearly out there, and it's wreaking havoc, if I'm not mistaken. I mean, families are actually losing loved ones. Like you mentioned, somebody lost a loved one yesterday.
Yeah. And
there's some more people who are actually in the ICU.
You know, we're just about the 1 year mark for some of our first COVID deaths that we saw.
Yes.
Yes. You know, I spoke to a couple other families, and you can tell that you know, the emotions are still raw 1 year later. This is not something to be taken lightly. You know, globally, it has been proven that this is what is being termed now as a pandemic of the unvaccinated. And currently in our country, we have a choice. You know, our choice is, there's no mandatory anything, there's a choice. The choice is get vaccinated or provide a test result. And I understand that there's a lot of debate taking place with that. But when we look at the numbers that are coming out, we need to give ourselves a reality check.
Yeah.
Both as vaccinated people, because we can still pass it on. Yeah. We may be protected from hospitalization and death, but we can still pass it on. So we have a responsibility to maintain our protocols. And for those who are not vaccinated, there is a gamble that you're taking, and you need to be extra careful and vigilant about your protocols, because the risk is there. And if we do reach the point to where there is a capacity, you know, it was only a few months ago that people died in the parking lot at KHMH.
Yeah. Yeah, and you know, there's so many things on screen, as a matter of fact, of what occurred in India, you know, whereby, you know, these folks were actually outside, they're waiting for a bed, they're waiting for a space in the hospital. And, you know, one of the things that you alluded to, Marlene, and I want to hit there, is that we're at a year for some families who have lost loved ones at the onset of the coronavirus. But and I feel those families actually still feel it to this date, and it is with heavy hearts, because what if the vaccine was from them? They are sure that their family member would have taken that vaccine and would have had life today. It's simple, Belize. All we need to do is to go on out there and get that vaccine so that we could be as safe as possible. Like you mentioned again, Marlene, it's not like if we're being lax, even though you've been vaccinated, there's a possibility you could still contract the virus. But what it does, it actually stops you from being severely ill, and of course from death. Yeah. And so we want for folks to understand these things.
And I do have to be clear that what they call the breakthrough infections, which is persons who are vaccinated, it's small. The percentage is small. We can look at the data from Europe, because most of them have used AstraZeneca vaccine, which is what most of us are vaccinated with. Yeah. So we can look at the data there, and we can tell that the majority of persons who have contracted COVID-19 were unvaccinated, and just a very small number of people who are vaccinated do get COVID. So you know, naturally I'm very data driven, you know that. So I always look at these numbers and I say, it's there for us to see. Yeah. And we still are at the point of where it's a choice. So whichever choice you make, I think it's critical that you know the risks that are associated. Yeah. Yesterday's cabinet brief did mention, though, that the Attorney General will be exploring what possibilities exist, or what they will do in terms of moving forward for two things: stricter measures, and also for the mandatory vaccination for certain groups of persons. That's not confirmed. It seems to be that they're maybe going to look at legislation and see what's possible. and that the curfew has been extended now to the end of August.
End of the month. And also to be explored, is vaccination cards, whereby vaccination passes, whereby if you've been fully vaccinated, then chances are you're able to go at certain places. We know what the curfew does, especially with respect to the economy and how it stifles the economy. The less we go, then of course the more stifling the economy is. So if we should go down to 8 o'clock or 9 o'clock, 8 o'clock or 6 o'clock in the evening, you know what the damper is when it comes to the economy, it can do to our country? These are the things I think we should look at as well.
And you know what, I'm cautiously having this conversation because I think I had 2 conversations just within the evening and night of yesterday where it takes an instant toll on your mental health.
It does.
Oh God, we're back there again. You know, I don't know if I could be locked down again. I don't know if my business can survive that again.
Yeah.
And so I think the fears that people have, people worry about jobs, people worry about tourism getting restarted and the challenges we may have there, and they're real fears. So I do think that while we can be hopeful that things will improve, that really isn't enough. We have to take action in our own personal responsibilities here. Yeah, so that's where we are today. But, you know, I was thinking, we talked about increased measures. Just this week, Jamaica rolled out their new curfew because they're seeing a spike in cases. And they're at 6 and 7 p.m. on weekdays. And on weekends, it's 2 p.m. in the afternoon. So you have no chance to hang out in there. They just give you church time, basically. In fact, I don't think they're allowed to go to churches. They put regulations for beaches. They put regulations for funerals. Everything. And so they haven't locked down, but they've really gotten very strict with their curfew because they're trying to get things under control. So we're not alone in this.
No, we're
Vaccination passes, that's becoming more and more common in other countries as well.
Yeah.
So
there are fights in other countries in terms of vaccinations and when to go on out. And now there are actually fights in other countries to mandate actually mask wearing, even though you've been vaccinated already. But the unvaccinated among us is definitely something that is putting that continued damper on. You have to wear a mask out there because you never know, you know. So these are the things that we're actually looking on. These are the stories making the news. And here at Channel 5, we make sure that we're on top of things in terms of providing you with the stories that are making the news. Every 6 o'clock in the evening, Monday to Friday, we're right here providing you with nothing but the best.
All right. And today we're going to help you understand because I know it was Alpha, Gamma, Epsilon, Delta, and you know, they're all very new to us. So we actually have 2 medical professionals coming in to break it down and explain what it means for us and what are the risks, whether you're unvaccinated, vaccinated, whether you know, what are the risks for your children, and the different age groups. We're going to go into detail with that in a 2-part conversation this morning.
All right. So I'll tell you what, though, I do hope that we've gotten you motivated to go on out and take the vaccine. We continue with additional motivation with our eye-opener taken from dailyom.com.
All right. When external factors shift, we have an opportunity to rediscover our core, the only true safe place to call home. There are times when our whole world seems to be falling apart around us, and we're not sure what to hold on to anymore. Sometimes our relationships crumble, and sometimes it's our physical environment. At other times, we can't put our finger on it, but we feel as if all the walls have fallen down around us and we're standing with nothing to lean on, exposed and vulnerable. These are the times in our lives when we are given an opportunity to see where we have established our sense of identity, safety, and well-being. We can cling to this core when things around us are falling apart, knowing that an inexhaustible light shines from within us. Times of external darkness can be a great gift in that they provide an opportunity to remember this inner light that shines regardless of the circumstances of our lives. When our external lives begin to come back together, we're able to lean a bit more lightly on the structures we used to call home, knowing more clearly than ever that our true home is the bright sun shining in our core.
You know, Marlene, we could actually get a few things out of that. But what it what comes to mind when I hear about it, especially reading it a few times over today, it simply tells me to tell you that you should respect your experiences.
Yeah.
Because as long as you know, experience, that teacher, that thing, experience gives you the ability to fathom what you're supposed to, what you're not supposed to. And it actually gives you the ability to fall back to what you've been through. And then, especially when it comes along again, you know what to do. Now, when external factors shifts, imagine you've got external factors and it shifts because you've been through that experience. You'll know exactly how to deal with it. For me, Marlene, and again, respect your experiences.
That's right. I totally agree. You know, I just love that the eye opener kind of points out one that sometimes you may not even know why you feel like everything's falling apart around you.
You might not. Yeah. You might not. But the recognition that you've got, because you might not even know, but there are some factors that might come into place that you'd see, you know what? I felt like this some time or the other, and this was how I dealt with it, because you've got the experience. Respect your experiences. That's how I feel about that.
All right, so that's our eye-opener for this morning, and now it's time for our weather check-in.
Yeah.
And we are going to go ahead and read the forecast. The general situation is for a passing tropical wave to support relatively moist and unstable weather conditions today.
Well, in the 24-hour forecast, it's saying cloudy at times today and probably cloudy tonight. A few showers and thunderstorms will occur around the country today and then over the south tonight.
All right. Our winds are going to be moving from the east at 5 to 15 knots, and the sea state are going to be slight to light chop. All
right. So we'll take a look at the temperatures before we get into those outlooks. Temperatures for today rising as high as 89 degrees Fahrenheit along the coast, 94 degrees Fahrenheit inland, and 78 degrees Fahrenheit up in the hills. Now it's going to be a little low tonight at 78 degrees, actually 81 degrees Fahrenheit coastal, 73 degrees Fahrenheit inland, and 66 up in the hills. And the extended forecast is saying for Thursday and Thursday night, it is for generally fair weather with isolated showers or isolated thunderstorms. There are no advisories, there are no watches, there are no warnings. Tropical cyclone formation is not expected throughout the next 48 hours. That's from the weather forecasters.
And we want to thank Angelia Guy for preparing that forecast.
Definitely. We did tell you exactly what to expect. We gave you a hint of what to expect within our first segment for today. But because of the importance of the topic, we'll be doubling up on those topics for today. And that's actually doctors breaking down the different COVID variants and their transmissibility. All right, so that's in the first and second segment. Dr. Mark Musa and Dr. Jorge Hidalgo will be joining us for the first and second segment this morning.
All right, and then the final conversation we'll be having for today, it's an art competition for special needs students. And so the Belize Brain Awareness Society, they're the ones hosting it. And so they're going to tell us all the details about what they're expecting in this particular competition. A great way to do an activity with the kids for the last of the summer.
I know. I check out some of the pictures. So cool.
Yeah.
So cool. But nonetheless, we need to take that break. Just before we do, though, we've got our birthday shout-out to give. And that birthday shout-out goes out to none other than Danielle Fuller. Happy birthday to you, D. Lovely picture. Great nails. I love them. I love them. Happy birthday to you. Wishing you all the very best from your entire family. From us here at Channel 5 and right here also on Open Your Eyes. We're going to take that break. When we come back, we'll be breaking down these variants with our doctors. Stay with us. We'll be back.
It's a fact that with Smart, you get truly unlimited everything. Only with Smart, you get unlimited data anytime. While with the other guy, it's only double data on weekends. With unlimited data every day with Smart, there's no need to wait. So, it's a fact that our unlimited plans beat the competition. Stop being measured and told when to use your data and get unlimited talk, text, and data. Experience the true unlimited plans with Smart. That's a fact. Make the switch and live smart.
Hola Tony. Hey Kevin, ¿qué onda? ¿Qué pasa? Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esta es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021 si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate, man.
Hey son, how was your first day at sixth form?
Really cool. It was great to see my friends, and I really love my teachers.
I'm so happy to hear that. I'm sorry I wasn't there for your first day, but I'll be back from Corozal next week.
It's okay, Dad. I can't wait to see you. Oh, and please remember, I still have some books I need to purchase.
Ah, yes. Let me e-cash you that right now. Money has been sent. I add a little extra cash just for you.
Whoa, Dad. Thanks. Got it.
You're welcome, sir.
Download the eCash app today and take your first step into a cashless lifestyle. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257. eCash, the future is here.
I feel honored. Truthfully, like I said, as a teacher, I feel that this is my highlight for the month, I guess. A beautiful way to start the month. To be among students who are aspiring to be someone. Today, we trust in you. We believe in you. Because to have been chosen out of the 350 students, there is a spark in you that we saw, that we believe in. Now it's up to you to go out there and let that spark illuminate the world. We need that in Belize, and we at Social Security are depending on you to bring that light to them.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And welcome back to Open Your Eyes. This, of course, is the first segment, and it comes courtesy of Fulltech Systems, our COVID-19 update. Now, yesterday we heard in the news that we are actually with variants in our country. It is now confirmed that we've got variants in our country, about 4 of them. So what we've done is that we've invited two doctors in to tell us exactly what these variants are, what it means for our country, and how we could eventually prevent from making it continue to spread. In with us, we've got Dr. Mark Musa. He's an internist. He's a gastroenterologist at the Belize Medical Associates. Good morning, sir. Thanks. I like that shirt, by the way. That's a nice one.
Thank you.
And Dr. Jorge Hidalgo, internist at Belize Healthcare Partners Limited. Good morning as well, and welcome, guys.
Thank you. Thanks for having us.
Alarming news. And I say this because we've been saying it ever so long that we need to continue to protect each other. We need to continue to adhere to the social distancing protocols and whatnot. So much so now that it has been confirmed that we've got variants in our country. When it comes to variants, we know the transmissibility rate is very high, especially with Delta. Let's start with you. Dr. Musa. What does this mean for our country? There are 4 variants in our country. What does this mean?
So the variants of concern, the 4 I think identified are the epsilon, the alpha, the delta, and the gamma. The main one that is very concerning, if you want to rank them, is the delta. And I think 9 out of the 20 or so positive cases were positive for delta.
Yeah.
But as doctors, we have been seeing a change in how the virus has been behaving for the last 2 to 3 months, since maybe the beginning of June. And we have noticed that it is far more infectious and easier to spread. And for every positive case that has been identified, you find that on contact tracing, more people have been infected. So it's felt that the Delta variant is at least 2 times more infectious or transmissible than the original variant. So that's the main concern, that it is so easy to spread. That makes it very important that we continue our preventative measures, or wearing of our masks, following physical distancing, avoiding overcrowding, and then to get the protection of the vaccine. We have the opportunity with the vaccine to add additional protection against severe disease, hospitalization, and death. So we cannot be putting pressure on the vaccine so early because we still have such a vulnerable population. I think only 33% of persons have had at least 1 dose, and I think 13.5% are fully vaccinated. Now, I think we are doing reasonably well in terms of, if you really look at it, starting the full rollout of the vaccination, when it became available to all 18-year-olds, was only in June of this year. At that time, we got a donation, I think, of 100,000 AstraZeneca from Mexico, and then it was rolled out to all persons 18 years or older. In fact, when I checked the statistics over the last 5 to 6 weeks, I think they only have about 3,000 to 5,000 AstraZeneca vaccines left from the Mexico donation. So that means over 90,000 doses have been delivered in 5 to 6 weeks. So it is very important, not that I think that they have been averaging about 2,500 vaccinations a day. That is very good. I think we had more a problem with access to vaccines rather than confusing it with vaccine hesitancy or anti-vaxxers and things like that. So it is very important to realize that none of these 2 main tools should be used. They should be used together. We can't say, oh, the vaccine isn't working because it's not preventing spread. The vaccine isn't designed as a barrier to spread. The barrier to spread is human-human interaction. We are spreading it amongst ourselves. So it is how well we follow the protocols that will get control of the spread. You can't vaccinate yourself out of a surge. So we have to be patient. We have to allow persons the opportunity to get the vaccine, but we also have to be following the protocols and be very strict, because this one is far more easy to catch. And all of us will at some point be exposed to it.
And that is the concern.
Yeah.
So let's take a moment, because I know when the release came out yesterday, we'd all been talking about Delta for so long. Internationally, Delta is the headline grabber. But people have questions about the other variants that have been detected. Epsilon, Gamma, and there's Alpha and Delta. So when you look at the origins, that's one thing to look at. You can look at the trends that they saw when they had their outbreak. But what do we know about these individual variants so far? Let's start with Gamma. That was the one that was predominant in Brazil.
Well, once again, thanks for the invitation. No? And as I think so, all of us been telling you guys since and in this forum that this virus and the nature of every virus is to survive, is to live. I mean that whatever we do, they will find a way how to survive. And one of the ways that the virus survive is that they are constantly mutate. And mutations, one of them could be basically passed inadvertently. Some others are going to take like in this one, the direction of the virus and take, we can say, command. And we've been seeing since the very beginning, the original SARS-CoV-2 virus, after a couple of months, was different. And now, of course, in December, we have, in September, actually, was the first variant in the UK reported, but actually, actively in December, we see the news, the Alpha one. And of course, after that, we see the surge of cases that we see in Brazil. And of course, it was in some areas was completely devastating, because in each type of circumstances, these variants were more transmissible.
Which
some
means they're easier to catch.
More easier to catch. Some other, we say, more virulent. That means that can make people sicker. And of course, if we say we have more people sick and more people, then the possibilities of mutation are there. And of course, Brazil, they fighting, and they have at that point a very, very difficult situation. And of course, we start to notice, as you remember, at the very beginning of the pandemic, we were more concerned about the vulnerable population. That means people with medical conditions and over 60 years old. But then when we see the new variant, especially the one in Brazil, we start to notice that other people on younger age with no medical background, they became sick and also ended in ICU. And of course, with mortality rates that higher than at the beginning we noticed. No?
And it was in Brazil too that we saw children being hospitalized for COVID. That was a concern coming out there. Is that from the Gamma variant?
At the beginning. Now, of course, with the Delta one, then we see the trend more constantly. We see more people in the 20s, 30s, and 40s being admitted in the hospital. Also, it's very difficult to see someone basically young in a young age, very ill in ICU, and of course, it's more difficult to see how they die.
So that's what we know about Gamma so far. Any other things that the public needs to understand about this particular variant?
Well, as we mentioned, each variant has his own particularities. And of course, as we mentioned at the beginning, the Alpha, he's more transmissible. The Gamma that we see that can affect a wide range of population, no discrimination, we can put it that way. But of course, as Dr. Musa mentioned already, our main concern right now is the Delta variant, because it's more transmissible, 60% more than compared with the other ones. We can say a person with chickenpox, you see someone, this one is comparable with that, because if I'm infected with the Delta variant, I can infect 8 to 9 people at the same time. I mean that also the transmission time is shorter. With the initial variant, we say our transmission rate starts at 6 days or more, but with the Delta one, it's less, 4 days.
We saw that at the onset of the pandemic, and I think people are still doing it right now. they would clear offices. If there was a breakout here, let's say per se, and we're supposed to, or there was a breakout somewhere, what they do is that they clear that office and they do it for a few days. This was at the onset of the pandemic. I think a few people are still doing it right now. But at the onset of the Delta, we know now that Delta is in here. What about the lifespan of that disease? Now, if we should clear out a spot, it was once a few days. Would we still recommend that we continue for a few days, or should we elevate the amount of days we should be out of that office?
Well, I think there are a couple of points with that question in terms of, I think that office or that building should, for example, if you have this office and you have multiple floors here, it might be that you might say, well, I will start my contact tracing on this floor, and you do contact tracing for the close contacts of whoever was the index case in that, or the first case in that office. It's important that when there are concerns about the rapid test accuracy in terms of picking up asymptomatic mild cases. So we have to then utilize PCRs to then truly determine if somebody who has been in close contact with a positive case, if they are truly negative or not. So the rapid test is still important to use as an initial screen. If it's still 50–60% accurate, that means that, and you identify, that means those persons have been identified as positive, they have to go into isolation. But I won't then say that's the end of your contact tracing. You should then go on and test the PCRs in persons who are close contact, household contacts, the direct workplace where you work closely with people, and definitely the symptomatic. Because you will miss cases if you don't do that additional screen with the PCR. Now, you cannot again put the PCR and say, well, why don't we do PCRs on everybody? Because we might end up where we were last October, where we were waiting 2 weeks for a result of the PCR, and then the persons really needing the PCR who are in Karl Huschner and things like that. So we have to be very tight with the protocols. And it is important that if you are tested, and you are tested both with the rapid and you test negative, and they do a PCR, that you go home and isolate for 5 days until that result comes back. Because there have been cases where people say, well, I tested negative, and I went back to work. And then 3–4 days later, the PCR comes back positive. So if you have been tested as a close contact and a PCR has been sent, you need to isolate and wait on your results. Make sure you don't develop any symptoms. Make sure your office has been sanitized. So I would say, yes, it's the close contacts. That section of the office needs to be closed for a period of time, 5 days, a week. Make sure good contact tracings are done before reopening.
Now, I hear very often where you talk about this high transmissibility, and you even mentioned that the progression is faster, that you identify it faster than we once were talking about earlier, I should say last year. Now, Minister of Health, Michelle Shabat, did note, I think, in contact tracing that where before you would have had a positive case and maybe 1 or 2 people in the household would have gotten it, and now they're finding the entire household has it. Explain to us what that means for people who are isolating at home, or people who may feel even mildly sick at home, what they should be doing to protect the rest of the household.
Well, as Dr. Musa mentioned already, as soon we notice or we are suspecting that we get in contact with someone, we need to be essentially self-consciousness in that case, and we need to make a decision to isolate ourselves. And of course, to protect the family and also to protect the close contacts. If we know our risk, what we need to take the different measures and to lower our risk. If we know that I have any particular condition that make me more vulnerable, then I need to make a conscious decision on that. No? And especially, or if I'm living with someone with a medical background and I get in contact with someone that is being tested positive, then we need to make that decision to isolate ourselves and also whatever person in the family that we are suspecting that get in contact with them as well. But most important than anything, we need to get in touch with the different lines that are available for the Ministry of Health. That way we can also get guidance. We can, as you see, we can describe the symptoms, and they can also give some advice as at what moment we need to go to the hospital to seek medical attention. That is important, because the earliest we can, if I became sick, the earliest I can get medical attention, then it's going to be more beneficial for me rather than wait until it's too late and end in an ICU with less chances.
Dr. Hidalgo, is it common? Is it common for viruses, especially like this one? We know that coronavirus is something that we've found a long time ago, but this just so happens that this is a different strain. Is it common for viruses to mutate like this?
Just and I also discussed it in a previous interview, and I say we have 6 different types of coronavirus, but this one in particular is have many situations that we need to see. One, this virus is too big. A normal RNA virus is usually the size is like 10 to 11 kilodaltons, and this one is 25 to 30. I mean, you see the huge amount. Also, if and by nature virus mutate. This particular one, if we think that this huge size of virus, then he will mutate in a certain way that he will commit suicide by itself. But the virus is too smart, this one, that have an ability to control the mutations. And that is making this virus more basically dangerous than the other ones. And that's the reason why we insist that we need to take all the different measures over different social distancing measurements and get vaccinated if you have opportunity. Because as the more people are exposed to the virus and more people are sick, then the chances of other mutation, we are right now concerned about the Delta. But tomorrow we will concern to other one, and as in the last time Dr. Musa mentioned, we are concerned of those type of variations that could be essentially of highly consequence. That means that we are not going to be able to detect it. It's going to be highly lethal. Those are that we are basically trying to prevent to reach that stage.
I'm glad you mentioned that, because there is a benefit in Belize with being kind of behind the global curve of how things happen, because we can see what's happening and where we're not necessarily paying attention and learning from the lessons. We at least know what to anticipate. In the US, for example, they're starting to talk about Lambda. They're starting to talk about, as I noted before, children being hospitalized. So there's almost a predictor of what can be for Belize. But coming back to the issue of variants that may come up, of all the variants that have been identified so far, what I hear mostly is more transmissible. Are there any new variants that have been identified that are more severe in how they impact the body?
Well, there's a concern about the Lambda variant, that it is not as that's the variant that first was detected in Peru at the end of last year and spread, I think, to Chile, Colombia. There is a concern that that isn't as transmissible as the Delta variant. And in fact, there's some Lambda in the United States, but you might find that you might say, well, why isn't the Lambda, if it's a little more deadly than the Delta, why isn't it doing more damage? Well, there's something called viral dominance, where the most infectious one is the one that pushes the other viruses aside. And so that is what is happening with the Delta versus the lambda, the gamma, things like that. If you notice, all of these variants have started in large populations, highly dense cities, in largely unvaccinated people at the time. So the surges have been astronomical in terms of its ease of transmissibility, in that it is naive to everybody who has never faced this virus before, and so it has, and the quicker the virus spreads, it has more chance to mutate, its genes to mutate, and then, so the initial concerns with the Delta is it's more transmissible. There will come a time when, if we allow the spread to go unmitigated, that there's a concern whether the vaccines might not offer the protection, and that the virus causes mutations that make the vaccines less effective. Now, that has definitely, with the Delta variant, the vaccines, persons who are fully vaccinated are still getting breakthrough infections, but in the vast majority, it's mild symptomatic disease. The concern is, even those mildly symptomatic, fully vaccinated persons have to view themselves as being transmitters of the virus as well. So your job as a fully vaccinated person is not over. Your responsibility is not over, because you have to also continue to practice your preventative measures in order to, for you not to aggravate or worsen the transmission of the virus. So if you look at somewhere like United States, we should never compare ourselves with the United States. We don't have their resources. We don't have their millions of vaccines. But you can say that their lifting or their guidance was purely based on information on the UK variant, the Alpha variant, and the original strain. So they have lifted wearing of masks. You see large crowds of people in concerts, at basketball games, things like that.
All sporting
events.
Yeah, seeing those pictures, it's just unreal. Especially knowing what we are still doing here.
But that shows that they are now referring to their pandemic as a pandemic of the unvaccinated. Because you're then seeing that the vaccine, a 60-year-old who has been fully vaccinated might have diabetes, might get a breakthrough infection, but get a mild form. The concern now is that you're seeing younger and fitter persons getting hospitalized, going into ICUs, going on a ventilator and dying. And the vaccine, it's then too late. You hear so many testimonials of them saying, can you please give me the vaccine now?
While they're on the
It's then too late.
Can I just get the question in, the conversation about the Delta Plus now? What is that?
I think that's just a variation of that they find that even with the Delta variant, that they have had additional genetic or mutations that make it even more transmissible. But you often hear people say, well, why are we making a big deal about a mortality rate of 1% or 2%? Well, it's because of how many people will be affected. It is 1% of what number? If it's 1% of a billion infected people, that's significant.
Of course.
If you compare it and say, well, Ebola virus, that has a 25% mortality, meningococcal meningitis has a high, but the sinister nature of this virus is that the asymptomatic, it has a long incubation period. It has the asymptomatic or the mildly symptomatic can be transmitting and not even knowing it. So more people will be affected or infected. So that 1% becomes significant if 1 million people are affected. If in Belize 200,000 or half our population is affected, 1% mortality rate makes that, what, 2,000? So with Ebola or these other things, the persons get ill very quickly. They go in their bed and
they
they're
don't even have
sick.
a chance to
They
spread
don't even
it. They
have,
die so quick.
exactly.
At the onset of the pandemic again, it was said that children between the ages, I think, birth to about 2 or 3 years old they don't have to wear a mask. Now we have detected these variants in our country, about 4 of them. Would you say that they're now supposed to wear a mask, especially with the transmittability rate of the Delta variant?
Well, that's one of the things that also we say that the people need to get vaccinated. Of course, it's difficult to put a mask in a child that age, you know, to trying to keep in, and that's the reason why we say if we are basically continued with this trend that we don't want to get vaccinated when we are put all this population at risk, not only the children's but also the vulnerable people, all the other different people with other different medical backgrounds. I mean that's the reason why we insist that we need to continue our social distancing, the measure that we know. And unfortunately, is like the same history of putting your seatbelt over and over and over, and you're still seeing people dying and in an accident because of they don't want to wear the seatbelt. Same thing, over and over. You need to wear your mask, but wear your mask properly. You're still seeing after more than a year of the pandemic, you see people with the mask over below the nose, not covered properly, don't wash their hands, all those simple things that have been proved effective. And one of the things simple to prove that the measures are effective is because you see the flu season. You basically don't see the common flu as usually seen in other years, just doing the simple things. And that helps us to the initial phase of the pandemic. I mean that those measures, we need to continue reinforcing those type of measures.
Yeah. You know, the point that you mentioned earlier about the fatality rate of 1%, you know, I think I appreciate breaking down the numbers to look at how many people would actually lose their lives to this disease. But for us, it's even worse because Belize has consistently, since the start of the pandemic, had a higher average fatality rate than most other countries. In other words, more people die from those who get infected of COVID-19. Do we understand, and you guys as medical professionals will know best, why is that?
I think there are a couple of factors. I think you have to look at your ability of testing. If you look at our second wave or surge from October to February of last year, at the start of it, we were predominantly using the PCR. So at one point, that became very inefficient, and we weren't testing enough. And so identifying your positive cases, there might have been, say, 50% more people who had a mild form that were so your denominator, what you're dividing, is actually, so that is called a case fatality rate. Because you divide by the documented positive cases. So I think Belize, if we have 341 deaths, I think we have about 14,500 identified cases. I think that's a significant underestimate because you might not have been identified. That shows you the strength.
Reported cases.
Yes, exactly.
Yeah, reported. But our fatality rate is almost double the global.
Not really. If you look at the case fatality rate of the global, there has been 4 million, say 300 deaths. There have been over 200 million documented cases. So that puts it at 2.1%. So we have a 2.34. Let me compare, in looking at the raw numbers, let me compare Trinidad and Jamaica, their experience to Belize. In January, Jamaica had approximately 250 deaths. They started to open up, and they have been going through a continuous surge. Their death total today is over 1,200.
Wow.
And that is likely not even with the Delta variant. They are now having to face the Delta variant, having had an additional 1,000 persons dying between January and now. And just today, they are going into serious lockdown mode again. Trinidad, again, in March had deaths less than 200. Today, they are over 1,100.
Wow.
They were facing the variant from Brazil and the UK variant. They now have to face the Delta variant. So in Belize, between March and August, we've had 27 deaths. We got to 300 very quickly. And that's why it's important that the vaccination plays an important role, because we have to look at the numbers. If we are seeing concerning numbers, hospitalizations going up, we have to encourage persons to bring down the transmission by following the guidance. We need targeted measures by the government. If we see Belize City over the last 4 weeks, every day getting 30 positive cases, then there has to be measures for Belize City.
I want to get to that, to talk about the response that may be necessary at this time. But since you did bring up Belize City, one of the factors that I think we don't talk about, and you know, it's been discussed before, that the south side of Belize City is of concern. But I would say it's many different communities experience this. Some of the households are just bigger. They're bigger with more people in a smaller space. And so your transmission rate can be much higher in these types of circumstances. Now, we can't change people living circumstances. I wish we would, but what's your advice? I mean, this is where a lot of the transmission will take place. Even if I have my mother protected at home, I go to work, I may bring it back to her, or one of the other 5 people in the house may.
Yeah, I think people have to start taking personal responsibility. And I think if you are a young person, you have to view yourself. You might say, and although the evidence is showing that, you might say, well, my risk with this virus is minimal. That's not showing in what's happening in the unvaccinated young people in the States and in other places, that the vaccine offers so much more protection at saving your life. So you have to then look at it that the vaccine is additional. You might say, well, I am a fit person, I take care of myself, that's good. But you also have to realize that you can be a transmitter of the virus to your household, to your vulnerable parents or grandparents or wife or whoever. So you have to then look at yourself as a spreader as well. And so your decision also has to involve whether the vaccination cannot be a selfish decision. It's not just about you. This isn't an individual disease. This is being spread by human to human contact. And I know people have concerns. It's very good to ask questions, get all the information you needed. But it cannot be that I just don't feel like take it. I want to be in a control of everything that's going on in my body. That's fine. But this is a different disease. You are part of, we all have to view ourselves as potential transmitters of the virus and follow the guidelines, but protect ourselves, protect our loved ones, do it for your family, do it for your community, do it for your country.
All right. So this is definitely a 2-part segment. Dr. Musa is in with us, Dr. Dalgo is in with us as well. And we're so glad that you're able to break down what it is like, especially living now with these variants that have been found in our country. We know that you've got some questions as well. We'll take a break. It is a 2-part segment like we mentioned. When we come back, we'll be asking some more questions. Stay with us. We'll be back.
Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Full-Tech Systems, your technology center, where you'll come for the price, but stay for the service.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
Smart continues to expand its internet coverage countrywide to help you live a smarter life.
Our villagers are very happy. They are pleased to know that Smart went the extra mile to put a tower in our village so that our villagers can get live stream on their TVs and they can get their kids doing their online classes. I want to say to Smart, thank you for making it possible for us to get internet in Gardenia village. We really do appreciate it.
Smart continues to take the internet and mobile services to communities across Belize. Now save even more when you bundle your Smart broadband with Smart mobile services. Smart, bringing people together.
And we're back, and we are continuing our conversation. Of course, yesterday there was official confirmation from the Ministry of Health on something that we already knew, which was that most likely the Delta variant was circulating in the country. And with that confirmation, we've taken the time to get Dr. Hidalgo and Dr. Musa with us to help to break down the information so people can understand and get the questions answered. One of the things to set the backdrop before we move into our viewers' questions is that while yesterday's report from the Ministry of Health talked about the number of cases identified with specific variants, it is important to put it into context that these samples were sent out about six weeks ago.
Yeah.
So I would say, or you can tell me, we'd guess that it is far more persons with Delta variants, each one of these variants in the country at this time.
Well, we usually say that in circumstances like that, we usually need to act as the worst case scenario. No? I mean, and I think so. The way we're trying to advise population is that, and been saying over and over that, even that is not what we're confirmed, we knew based on the clinical cases and the tendency that more likely Delta was here for a while, no? And we were acting and advice based on that information, no? Trying to act as the worst case scenario. And that's what we've been doing, you know. Of course, right now with confirmation things change a little bit, but just to say, we've been discussing that with Mark and the other part of the group that we need to act based on the worst case scenario.
Yeah, and I I appreciated that from the time the variant was detected, while we didn't have the confirmation, the messaging basically was, it's most likely Delta, it's most likely Delta. Let's get into some of our viewers' questions. So one of the things, and I know this is a common question that you get.
Yeah.
So if Christina wants to know, if I got vaccinated, will I be safe against these new variants?
With the Delta variant, for example, if we look at the AstraZeneca vaccine, the AstraZeneca vaccine is still extremely effective, over 90%, 92% effective in a fully vaccinated person at preventing severe disease, hospitalization, and death. For any medical treatment, that's an A+. When I go to school, if I get over 90, that's A+.
Yeah.
So the starting point is, it is effective at saving your life. One dose at preventing the serious complications is about 70%.
Okay.
What has significant, no, you can't just, you have to allow the immunity to build up, and it builds up over a few weeks after each dose. And so we are currently recommending 8 weeks for the second dose, but somebody is considered fully vaccinated at 10 weeks, 2 weeks after their second shot. So the vaccine works at the severe end of the spectrum, at saving your life, preventing serious complications, and ending up in the hospital. There has been a drop-off at preventing transmissibility because of how infectious the Delta variant is. So the overall effectiveness of the getting infected with one dose is only 30%. It goes up to 60% of developing symptomatic disease, which is with 2 doses. So that means mild or even asymptomatic persons detected on contact tracing. So that 60% includes prevention of asymptomatic, mild to the severe spectrum. So that has been the drop-off because of how infectious or easily transmitted the Delta variant is. Even with the Pfizer vaccine, initially they were over 90% effective at even preventing transmission. They have noticed a drop-off in their ability to prevent mild infections to about 60–70% fully vaccinated as well. But they are still effective over 95% of preventing the Pfizer at preventing severe disease and death.
So let's stay on this topic, because one of the questions is looking at the vaccines that are available in Belize and that have been administered. So AstraZeneca is one. The Sinopharm, and I know we're expecting both Pfizer and the Johnson & Johnson vaccine. What about, how do they compare against the variants?
The Sinopharm and which other one?
The Johnson & Johnson.
Okay. The Johnson & Johnson is a one-dose vaccine, which uses a similar platform like the AstraZeneca, which uses a viral vector, which is a milder virus, using the genetic material of the virus and introducing that to a person, and that genetic material, the RNA, first and foremost, that does not interact with the human DNA. Our human DNA is protected inside the nucleus. The RNA cannot get into the nucleus and interact with your virus, with your DNA. So the RNA then goes into your cells and takes over and sends a message. Please make the spike protein so that I can then build immunity to the spike protein, which is the little attachment receptor that makes the virus stick onto cells and invade your cells. So that is the way it's trying to mount a controlled immune response by using the vaccination to introduce a controlled production of the spike protein so that you can build your own antibodies in a controlled way and your body isn't overwhelmed by uncontrolled infection.
Just to add, as you see, as you mentioned, there are several vaccines with different platform. But just to put it in a simple way, each vaccine and each platform, essentially it will give your body the necessary resources that if at some point you became infected with the virus, the body will have the ability to fight the virus. I mean that, of course, as we mentioned, there are different platforms that they use, but all of them are with the same idea and the same concept that give you the body the ability to have the resources to fight the virus when you get in contact with them.
I always like to tell people when we talk about immunity, imagine a little army being built inside you to fight off the opponent.
I think for that Johnson & Johnson, the answer to the question is it is about 85% effective at preventing severe disease.
Severe, okay.
With one dose. With one dose. You're considered fully. No, they're talking about whether they will need a booster at 8 months or things like that.
Here.
So, but that's the Sinopharm and the Sinovac, which are inactivated, is the old version of vaccines.
Okay.
Like the old polio vaccine is a inactivated, weakened virus, where it can't infect you and cause uncontrolled disease, but it can still mount an immune response. That is the platform that Sinopharm, Sinovac uses. So
Alana wants to know, how long does the vaccine last, and will Belize start giving boosters soon since the increasing numbers? Now, the second one is a Ministry of Health question, but the first one is talking about the effectiveness and how long.
Well, you know, we are still collecting data on that. Approximately, we can say probably 6 to 12 months. But of course, basically we are still building data on that. And as we mentioned also the last time in terms of the boosters, what we are saying right now, we need to try to make the effort that everyone gets the first dosage, especially those that are not getting it, and those that already got the first dosage, trying to get the second dosage. We are, in terms of the booster, what is being discussing is that probably the initial group of people that will get it is those that are with some medical background and the more vulnerable one, and it's something that is being doing in all the countries. Of course, we still not know at this stage how soon and when this booster is going to be recommended, but at least some of the discussion is that probably more likely those that are more vulnerable ones.
Can I just say something about the boosters? If you listen to WHO, they are discouraging first world countries to give boosters. Because if you look at the distribution of the vaccines, the 50 poorest countries have only received 1.1% of vaccinations. The 20 richest countries have received over 50% of the vaccination. That is a recipe if we continue like that. Southeast Asia is a breeding ground for more mutations. They are densely populated, they are unvaccinated. As a global pandemic response, the WHO, PAHO are trying to encourage countries to donate to COVAX to get the majority, because we will be going through this vicious cycle if we don't get
because if a mutation pops up in these unvaccinated populated areas that doesn't work with the vaccine, then we're back to March 2020. That's what it feels like.
Some at the point where we are right now, some, especially when it comes to frontline workers, they've been asked, you know what, in order for you to come on in, you need to be, especially if you're an anti-vaxxer, you don't want to be vaccinated, then you need to bring a test in every so often. But they're also saying that some folks, you might not be able to get the vaccine because of underlying conditions or what you're suffering from. What would be some of these, what would be some of the things that you might be suffering from that would prevent you from getting a vaccine?
The only contraindication to get the vaccine is if you have a documented allergy to some of the components of the vaccine. That's the only one that we can say.
So, okay. So if we go in and say, you know what, doc, I'm suffering from such ailment, and, you know, then you would recommend you're not able to get the vaccine. What would be some of those ailments?
Again, so far, what we've seen, and most of the people are coming to get advice to get the vaccines, and unless if you are, or especially with the Astra, if you are probably receiving anticoagulation treatment because of an active clot, then we say that should be one of the contraindications. But most of the time, the only say is if you are allergic to any of the components of the vaccine. I don't know, you want to add something?
Yeah, I think it's important. I think persons with comorbidity, if you have diabetes, if you have high blood pressure, cardiovascular disease, if you've had a stroke, if you have some immune compromised condition like lupus, rheumatoid arthritis, that you are on immunosuppressants, in fact, the vaccine is more beneficial to you in terms of the level of protection. And the question more is, that's where the boosters come in. Because if you have a lower level of immune response to the vaccine, it might be that these higher risk groups might need a booster 6 months, 8 months, 12 months down the road as a start. But in terms of protection, if you face COVID unvaccinated and you have these comorbidities, including age, if you're over 60 and you have these medical conditions, you will be far more protected than if you're vaccinated than you're not. And so that offers even more protection in that high risk group.
Heavy skepticism also comes along with hearing from friends or family members what happens following taking the vaccine. Is it normal for a reaction following taking a vaccine, like feeling a little ill, probably some soreness? Is that normal?
Yes, well, one of the things, as everything we do, if you take an aspirin, you can have a reaction. I mean, that the same thing with a vaccine. You can, if you have a vaccine, most of the time you will have, most commonly, but not necessarily, but most commonly, the major symptoms is pain in the site of the injection. Probably for a couple of days you will feel muscle ache, tiredness, and in some cases you can have a spike of fever for a day or two. That is something that is expected, and this is most commonly seen.
So let me get to this question here. What is the best way to protect our unvaccinated children, especially the ones that have underlying conditions?
Well, first of all, they have not even been given, particularly in Belize, the under 18 are still very vulnerable. So the preventative measures, both for themselves, but you as a family, and what you expose the child to is very important. It's important that everybody in your bubble or your circle are vaccinated, so that reduces, it doesn't eliminate the risk of transmission, but it significantly reduces. And the importance of explaining now the big question about school and things like that is a significant thing. Now,
well, that's one that they're asking right now. What's your advice on face-to-face school?
I personally would say that there are worrying trends in Belize right now with the Delta variant and the increase in cases. And if you look at the three scenarios, if you go back to full face-to-face learning, a hybrid system where maybe half students go in and half go online and things like that, or fully go online. My personal opinion would be to start online. We are hearing that we should get a donation of the Pfizer vaccine, which is licensed and has been used in the 12 to 18-year-old group. That's a significant portion of that's high school and sixth form and tertiary education there. That still leaves the primary school vulnerable. But I think, and if it's the Pfizer, you can be fully vaccinated or get your 2 doses in 3 weeks.
Oh, wow.
It is not the 8 weeks. So if that is a real possibility, I would advise that we should at least start there. Offering the Pfizer vaccine to high school, sixth form, and they are the ones actually who should be more versed at accessing online and internet. Now, there is always the question about, does everybody have equal access to the internet and things like that. But I would say in terms of risk, we should at least give ourselves the opportunity in that group to get as many vaccines available if that donation comes through. The younger group still remains, and they will have to, I think the primary school, again, they are younger, but I would still think that they have, at this point, no possibility of getting any protection from the vaccine. So I would say, because we have rising numbers with a very infectious virus, I would say they should start online again. And that would be my advice.
Yeah, I noticed you said very clearly a personal
Your
opinion.
personal, yeah.
It's a tricky situation.
Yeah.
We know how children have been suffering, and we know that there is a need for children to return to classrooms, but is it the right time? And that's a question I'm sure the Ministry of Education and Ministry of Health have to ask themselves. I want to get to some of the measures that we do have in place, but before we do, we have one more question on eligibility for vaccines. Can people with asthma take the vaccine?
Yes.
Okay.
And as we mentioned before, and Dr. Musa mentioned, the patients would have some comorbidities, again, we repeated again, diabetes, patient with a kind of rheumatoid arthritis, lupus, patient with asthma, even we discussed about also, I need to mention that the pregnancy patients, because pregnancy, it can put you in additional risk and more vulnerable to ending in an ICU. Also, those populations are the ones that definitely they need to get the vaccine more.
Yeah, yeah. So let's come back to the measures. I know that both of you are consulted very often by the Ministry of Health in looking at, they say they're following the science, they're taking guidance. Dr. Musa, you have spoken out before on decisions that the government has made in reopening the country or allowing persons in. Do you think it's time for us to implement stricter measures than what are currently in place?
I would say, if you're following the numbers, just like what happened in Midway and Santa Elena in the Toledo district, where you saw a small village, but they got quick control by going in and doing a strict lockdown for 2 weeks, 3 weeks, and supporting that community, making sure you're testing everybody, isolating and quarantining persons, and supporting them with food and a stipend and things like that. Now, the concern to me is the Belize district, or the Belize city. And it has been consistently, you're getting 30, 40 positive cases a day. I think a targeted increase in restrictions for a 2 to 3 week period, just to get a handle of the transmission, would be my advice. And that may be in the form of say, bringing up the curfew to 8, say, go back to take-out dining in restaurants, closing the casino for 3 weeks, that type of behavior. Because people might say, well, the virus could travel during the day as well.
Oh,
no?
we hear that all the time.
I mean, but it's the type of behavior. I mean, if you want to take a drink for that 3 weeks, please do it in your house.
You do it in your house.
Yeah.
I know even interactions within the workplace, that's something you have to look at, where you take off your mask or who you take off your mask with.
Exactly. That's, as I always say, the pandemic and the coronavirus is a social responsibility. We cannot put everything to the government. Of course, the government, they need to do what they did, but we have also, as an individuals, be responsible in the way we act and in the different areas of how we conduct ourselves. No? And again, back to that, we need to make sure now to be very strict, wearing our mask, make sure that we are in a ventilated room, trying to avoid crowded gatherings and all those things. Now, right now, it's important that we observe and follow that recommendation that we are over and over saying, but that we're improving that are working.
I think as well we underestimate that the vulnerability of our health system, and we have healthcare workers, lab techs, public health inspectors, nurses, doctors, who have been going at this for 18 months. Those people are under major stress. They are mental, physical, they face burnout. We need to help them as well. And so if you follow the numbers, I think targeted increase in restrictions where the number applies, because this thing can go south very quickly. It can go, so you might say, well, the deaths tend to follow 6 weeks, 2 months down the road. But once you have seen, that is too late. It's too late then.
We're at 16 active hospitalizations reported now. We don't know the number of persons who are awaiting confirmation from PCR tests. So we know that we're getting to that point that was more than our healthcare system can handle.
And of course, back again on what we saying at the beginning in terms of our health system is not strong enough, and also we don't want to see the ICU soon overwhelming on cases, and we are essentially incapable to handle it. No?
Wow.
Now let me ask if one of the things yesterday in the cabinet brief was that they are exploring the option, the Attorney General is exploring the options of mandatory vaccination. What's your take on this?
I would recommend mandatory is compulsory is different than mandatory or encouragement. I personally think that we're not doing badly. I would not pick any fight with anybody right now. I think we need to access more vaccines. We need to answer persons' questions, legitimate questions. But at some point, I think it's way too early to be rewarding vaccinated people and lumping everybody who has not been vaccinated so far as anti-vaxxers and things like that. I think most persons can be encouraged if their fears, if their concerns are discussed and allayed. And so I think it's too early to go that way. To me, I think we should get more vaccines. If we are continuing to vaccinate 2,500 persons a day, there might come a point where you reach a sticking point. But where if you reach 70% of policemen and you can't get the next 30, then that's where you say, look, you want your right to work also infringes on the government or the police department ensuring a safe workplace and your ability to transmit the virus and things like that. And so that's where the testing comes in, and you can't just say, well, and it's my right to refuse it, and I have no responsibility, not even to bring in a negative test. But I think we're not that, to me, I don't think we're doing that badly in terms of if we can consistently answer people's concerns, getting more vaccines, getting more access to other types of vaccines like the Pfizer. I don't think we're at that point yet.
You said something, and let's expand on that just a little bit here. You said that you can't take the unvaccinated people and lump them all together as anti-vaxxers. And that, in fact, is one of the things I think we should explore. Anti-vaxxers are different from people who are hesitant to get vaccinated. Do you want to explain that?
Well, I think so. I usually say it in this way. You know, we have these two different groups. Of course, one that essentially are trying to have this type of fight. We are fighting right now two situations. We are fighting the pandemia, and we are fighting the infodemia. This type of misinformation and misguidance that at the end of the day, it will take all these people basically to a hospital and dying. And of course, they have the other group that they are hesitant because they have probably a valid question, because probably they have a medical background and they say, okay, I would like to wait. Basically, what we are saying for those type of people that are hesitant, that please go and seek for medical advice. If you have, we've seen several everyday people that came say, you know what, doc, I want to put the vaccine, but I have A, B, and C questions that I would like for you to go through and answer and facilitate. And that's we advise them and trying to explain what is the scenario. The other thing is, you know, that and we see that since the very beginning of the pandemic, that you don't want to get your vaccine that have properly documentation is basically being on trial, and we know the safety of that. But yes, you want to get a kit of medication over the counter that you don't know what you are getting, but then because they say, okay, this is a kit that brings A, B, C, and T medication that will prevent you to get the coronavirus, and those things are not proven. No? You know, you have something that is proven and something that is not proven, but people want to go into that direction. I mean, that I say, let's seek medical advice for the questions you have in case you want to get vaccinated, but you are afraid.
And we've seen that in the questions, even the ones asked today. I mean, people ask, you know, if I have asthma, can I get the vaccine? If I have thrombosis, can I get the vaccine? If I have seizures, can I get the vaccine? So they're genuine concerns versus just an absolute stance against vaccinations.
Yeah, and I think we have to be careful, you know, when we watch the TV, and don't compare ourselves with America or Europe or things like that. I still think, in reality, the vaccine campaign, the vaccination campaign, truly started July the 1st, when all phases were opened up.
Yeah.
And even those persons who got it, you cannot vaccinate 100,000. If I get 100,000 doses today, you physically cannot vaccinate 100,000 people
in one day.
In one day.
Yeah.
So we have to be patient. Those people getting vaccinated on July 1st will get their second dose September the 1st, roughly.
Yeah.
We're not, if we are saying, if 95,000 doses have been given in 6 weeks, that is not anti-vaxxers. So I think
so you feel that the uptake has been positive?
I think so.
Okay. Now let's come back to something else, because you mentioned it, and it is also, I know, a concern that vaccinated people have shared, where they feel that we have, you know, made the decision to do the right thing, proactive about taking the vaccine. We should be rewarded and be given passes and free paper, essentially, to move around. And, you know, hey, France is doing it, other places are doing it. What are your thoughts on this for Belize?
I think so. As we don't have the luxury and also those health systems very strong. No? I mean, I think so. We are not in that position at this stage. No? And I don't know if we are going to be at some point. No? But I think so. Get vaccinated is a responsibility, a social responsibility, and I think so. That is part of us as a society. We need to contribute. And we don't expect to get reward for something that is my responsibility.
Yeah, I would agree. I don't think it's the right time. I don't think we've fully rolled out the vaccine long enough to say that I have offered and we're stuck at 50% for 3 months and we're not moving anywhere, like what might be happening in the US. So I think the vaccinated for now, you need to be reassured that your reward for now is that if you likely contract the virus, you won't end up in a hospital, you won't develop severe disease, and you won't die. The other things about whether I can go to a nightclub and things like that is really, in the greater scheme of things, not important at this point.
All right.
And let's just take the opportunity, though, because I think it's we haven't really talked about things like symptoms. So people may not know that they have actually contracted this particular variant, and the symptoms have changed.
Yes, we've seen a different trend of symptoms that are more unspecific. No? I mean, that you can probably have a headache at the beginning, probably you can have a muscle ache. Sometimes we can have patients with gastrointestinal symptoms, diarrhea. I mean that the presentation and the symptoms that we are seeing right now are more, we can say, atypical and not the classic symptoms that we have at the very beginning.
Yeah, because first we were looking for high fever and shortness of breath and a dry cough.
Yeah, I think recently, and I think it's almost like some of the symptoms like the common cold, runny nose or obstructive sinus problems, things like that. The other aspect as well in terms of the change in symptoms is I think people are deteriorating quicker in terms of the ones that are unvaccinated in hospital, even if they are young and have no comorbidity, you see them running into problems quicker. In the past, you might have gotten a little sign that your oxygen level is slowly dropping. This is happening much quicker. And the theory behind it is that the Delta variant is so infectious that it replicates so rapidly that it achieves a viral load that overwhelms your system much quicker than the original variant or any other variant. So as medical doctors, we have to be very careful.
Well, that actually was my next question, because in the first and second wave, one of the message coming out from the medical community was, don't take some symptoms for granted, get to the hospital quickly. Like the minute you start feeling that extreme fatigue or shortness of breath, go to the hospital or call Ministry of Health, because you could be on the brink of very severe COVID. What do we say are these triggers now, especially given the context you just explained?
Well, it's basically, as we mentioned at the beginning, if in case you get in contact with a patient that you knew that had COVID, and you make a decision to isolate yourself, then trying to get immediately in touch with your family physician or the Ministry of Health, and then call them and inform them that you will get in touch, and then you will get a call every day to find out about your symptoms. But also, if you notice that something is changing, then you need to call them and seek medical attention as soon as possible, because of course the time and also the behavior of this Delta virus is more aggressive, more different, and then you can get into serious illness soon and needed to be hospitalized sooner than in the previous cases, in the previous waves.
Are we still worried about our elderly population with Delta if they've been vaccinated?
Yeah. Yes, I think that's the concern why you hear of persons of whether that group will need boosters, because their immune response might not be as robust as a younger person in terms of the level of protection or the level of antibodies they can achieve. So that's why they're looking into trying to see if boosters are needed a little earlier for people who are over 60, people who have the high-risk conditions that we mentioned before. So the immune system of an elderly person is not as robust as a young person. Yeah. So
and how is it that people in their 30s are passing away from COVID now? It seems from the Delta variant. What is it, just because they're unvaccinated? What's the link?
Well, the Delta virus, as we are seeing, is most also virulent. Also have some of the mutation have the ability to escape our immune system defenses. Mean that the way this virus is behaving is more aggressive, and then that's why we see that younger people, especially those that are unvaccinated, are more vulnerable. Also, is more aggressive. It makes people sicker more quicker, and then probably if we are in the 30s or in the 40s, I can probably say, okay, I can fight that.
Yeah.
And then probably say, okay, I can stay at home and I will take more longer seek medical attention.
Yeah.
And then when you reach to the hospital, you are really, really in a bad condition, and you end into the ICU. And the time frame that we have to act, we don't have that luxury.
Yeah, so they actually act at a later time, because they feel youth probably.
Among other things.
Yeah, among other things.
Okay. I think if you, sorry, if you,
Go ahead.
if you were going to compare, say we were discussing earlier off air, United States and say England. United States has, say, roughly a little over 50% fully vaccinated. But they have gone the other extreme, where they have removed all the physical distancing, the wearing of masks. So it becomes a percentage thing. The young people have a higher of gatherings and socializing. In England, they have a 70% vaccinated coverage, but they have been slower to lift the restrictions. So they have gotten much quicker control of their Delta variant surge than what America is facing. And so the young person, I mean, even in Belize, we have had a few cases where you might see, I think 3-4 weeks ago, we had a 23-year-old with no comorbidity, was very unwell on high flow oxygen, and she had to be admitted for a week. But she was in trouble, and luckily she got the right treatment and she pulled through, but she was unvaccinated. We hear of a 35-year-old unvaccinated person who succumbed the last few days. Yet you hear of families who are fully vaccinated might get mild infection, including the 60, 70-year-old with diabetes, and they have the vaccine is working in that group.
Yeah.
So the vaccine protection will become the single most determinant of how you fare against the virus.
Wow, big statement. Yeah. Dr. Musa, Dr. Hidalgo, we're so grateful that you guys could have joined us this morning to break down how things are, especially with the detection of these 4 variants. Thank you so very much for joining us, both of you.
Thank you for the invitation.
Wow. All right, so we're about to take a commercial break. When we come back, we've got our final segment for you. This one is all about the first back-to-school art competition for special needs students. We can't wait to hear about it. We'll be back in a few to share that with you. Stay with us. We'll be back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Imagine going through your entire day without the burden and risk of carrying cash on you. Belize's shift to digital wallets has begun with eCash. We can now skip the cash when collecting money or paying for our essentials, all while using a fast, easy, and secure platform.
Simply add funds to your wallet via bank transfer or at an agent, and you're good to go.
You will be able to make quick, easy payments simply by scanning QR codes. And best of all, it all happens just like that. Payments are as easy as clicking a link online or scanning a QR code.
Download the eCash app from the Google Play and Apple App Store today and take your first step into a cashless lifestyle.
The future is here with eCash.
For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257 to find out more.
I feel honored. Truthfully, like I said, as a teacher, I feel that this is my highlight for the month, I guess. A beautiful way to start the month. To be among students who are aspiring to be someone. Today, we trust in you. We believe in you. Because to have been chosen out of the 350 students, there is a spark in you that we saw, that we believe in. Now it's up to you to go out there and let that spark illuminate the world. We are depending on you to bring that life to them.
The TV you love is always with you, from live TV, sports, and on-demand titles. Choose your plan today. Plans start as low as $15 per month. My TV, entertainment, anytime, anywhere.
Introducing Edam A cheese, the A+ Dutch cheese to hit the Belizean market. As the name says, it is of A-class quality, the best Dutch cheese in Belize. Edam A cheese is creamier, less salty, and simply more delicious. Don't be left out. Get your A cheese at a supermarket near you. A cheese exclusively distributed by Unitex Company Limited. Call us at 610-3626 or 610-8910. Follow us on Facebook at Unitex Belize.
And I got vaccinated to protect myself, my family, my patients, and my community.
Good morning,
Ines here. I got my vaccine because I want to protect my family, especially my patients, and everybody around here. Everybody I come in contact with.
Mi nombre es Luis Chinchilla. Me vacuné porque quiero proteger mis familias y mis pacientes.
I'm Dr. Nunes, internist at Sorrentino Hospital, and I got vaccinated to protect myself, my staff, and my patients.
Soy el doctor Eduardo García. He trabajado 22 años en Belice y yo me puse la vacuna del COVID por la sencilla razón de protegerme a mí mismo, proteger a mi familia y proteger al país de Belice, porque es importante pensar en Belice.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
And welcome back to Open Your Eyes. We're moving now into our third and final segment for the morning. Now, this one is actually about a first back-to-school art competition for special needs children. Oh, this is so cute. I've seen a picture, and it's so cool. Kalia Nunes is actually the founder of the Belize Brain Awareness Society. Kalia is in with us. She's actually on screen. Hi, Kay.
Hello, hello. Good morning.
Good morning. It's so nice to see you. Good morning again. And we'd like to, yeah, of course, we'd like to know. I mean, you've got this first back to school art competition going on for special needs children. Tell us about this competition and how did you actually came up with it?
Well, as you guys know that August is always our time for back to school. And so we always try to look at the special needs children, being that we are an organization that deals with the brain. So here we have Dr. Carter. She funded this competition. This is only competition one, and they're only for special needs children. And we also have a lady, Miss Janice, in the States that will be sending some packages and book bags, for special needs children, 20 of them, to be supplied in Belize in the early part of September.
Yeah.
So Dr. Carter, who founded this, who funded the event, she specifically gave instructions of only special needs children that she wants to assist, and that she will be paying $200 towards their school fees, and the other one we will be doing another competition as well.
Aww.
And if she wants to do only lower level at schools, no? We need to get the little special ability children to be more, to show more of their artistic side.
Yeah.
To know that they're appreciated, they're loved, you know? And so this goes well with our back to school special project that we do every summer.
You did say lower level school. When you say that, what age range or grade range you're talking about?
From preschool to standard one.
And how?
And so if the parents can also have like pictures of showing that they're doing it, and send it to the Facebook page, whereby the directors will then, the administrators of the page will then deliberate on it based on the criteria that we have there.
So what are the qualifications to enter this competition?
Well, they must be a special ability child, known that they can prove that they are a special ability child. They can be of any school, as long as they are known to be a child with special abilities.
Yeah.
So that's it. The stuff right there. We normally
and
see.
you're talking about mental and physical, or developmental and physical, right?
Yes, ma'am. Mental and physical.
Okay. So
right. Once it can be proven, mentally or physically or neurologically, we take it.
Okay.
Wow.
Now this is a great, I imagine that part of the thought process behind this is looking at the relationship between parent and child. How involved should parents be in creating the art?
Well, it calls for individuality. The child can say, you know, this is how I want to draw, mommy. I want to draw my home. And just allow the child to express him or herself freely through their art. We're not looking for perfect art. We're not looking for anything of that sort. We're just looking for an art that speaks about it will tell you about the child and what the child sees as their happy place.
Yeah.
You know? Because then it doesn't have to be the parent is intervening, because we're not looking for an awesome art. We're just looking to see how well the child expresses him or herself through their art.
And it's is there a theme for the specific art? Is there a specific art you're looking for? A themed one?
No. It just has my special place. That's the theme of it. And the criteria we want parents to do, send at least 4 images or more to show that the child is doing the work. No?
Yeah.
And stuff like that. Because I guess it will be seen. I am a teacher, so you will know, like, when you see a higher end photography, you will know that, okay, well, it is.
You already know when it's parents' work or children's work, right?
Oh yes, I really know that one there. So it blends in with our back to school special. Back to school special is a program that we do every August.
Yeah.
For to screen special children.
Okay.
Wow.
So when we are screening special children, and these are children of all different ages, and all different disabilities within the classroom, the behavior, the speech, the learning ability child, the child that has the mental issue, and all these different ones in a classroom, that parents really do not even know these panelists, sorry, these specialists in Belize,
Mm-hmm.
and that parents really do need to get them assessed so that when they're going into schools, that their parent can say, you know what, my child is this way, so he may not be able to complete 50 work, but he can at least do 20.
Yeah.
You know, and I think that's the thing. We need to get more into letting others know more about these autistic children and these learning disability cases, so we can understand them much better.
Yeah.
Well, I think it's going to be interesting to see what these
I do
children
too.
identify as their favorite place. Tell us about the thought process behind the theme selection.
Well, the thought process came from the directors. First, I had an idea, and then I went in and I was expressing it, and they said, no, that not sound like something when I could draw. And so a director said, how about my special place? And I said, okay, that's it right there, my special place indeed.
Yeah.
Because we all have that place whereby...
Uh-oh. It seems we've lost.
Yeah, it seems we've lost your audio.
So
all right, there you go. Mm-hmm. But you were saying because we all have that special place.
Yes, sir. We all have that special place. Sorry about that. Someone was trying to contact the device now. Yes, because we all have that special place. We wanted the children to express where is a special place, and it also blends itself psychologically to so what they find as a place of peace, a place of calmness, a place that mentally relaxes them.
Yeah. Wow. I just feel so cozy just thinking about that, a special place. But, Kay, I'd like to, especially with you and your passion towards this, how important it is for parents, especially with children with special needs, to engage in their life and try to get them to special places. How important is that?
It's very important. It helps them to develop far much better. I take example from myself. I was dyslexic when I was younger.
Wow.
I was very much dyslexic, and I had a reading delay. So I learned to read by the time I went to standard 2. I really cannot say I was not screened, I was not anything. I remember one teacher, she told my grandmother when I was in standard 1, she said, I feel sorry for her, I can't read. And my grandmother said, oh, you feel sorry for her, I can't read? Blah, 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 blah. Well, you don't know, loser, my granny gone. And she got these little cards, these little post-its, and she put words on them, and she had them all wrong places, like refrigerator, door, and I learned to read. And then she bought newspaper, and I learned to read from that. What that taught me that summer, I didn't play it at all that summer. What that taught me that summer was the development and the relationship I gathered through that process. My grandmother was there with me to the end. By the time I went to standard 2, I was reading and I came in first.
Wow. Wow.
And when I was in standard 3, I had a problem with songs different. And so I and E was my 2 major complications, and B and D were my 2 major complications. So I really didn't know I was dyslexic, and I grew older and I still had problems with B and D. I became a teacher and I saw students have that complication, and I got into studying the special learners, and I found out what it was, and I said, I had that when I was younger. And it was so amazing to me to know that they overlooked me, but my grandmother took a chance on me.
Yeah.
But if you are taking a chance out on your child, you do not know where he or she may lead to.
Yeah.
And that's what I am trying to get at when it comes with this organization, because we all have a special ability within ourselves, but we need help no matter how we look at things.
All right, okay. So all they need to do is to check out the Facebook page to find out how to do.
Yes, check out the Facebook page, Belize Brain Awareness Society, and the Facebook group, Belize Brain Awareness Society, and our Instagram page, Belize Brainers and the Society, I believe. And you guys will see these, and we have a lot of upcoming events as well. We try to do an activity every month, but everything we do is pertaining to those with the brain.
All right. Okay. It's so nice to have had you in with us this morning to talk about this. We know that it's going to be a fruitful one. It got started yesterday, and it will conclude on when?
Tuesday, the 17th.
All right. We hope to hear back from you again with the winner and see the winning competition poster. All right.
You guys will surely see it. You guys will surely see it.
All right.
Try me.
All right, Kayla and Eunice, thank you so very much for joining us this morning, and do have a lovely day.
You too. Bye.
All right. What a way to end a Wednesday. I'll tell you what, we need to take our final break. When we come back, we'll be wrapping things up. Stay with us. We'll be back.
Hey son, how was your first day at sixth form?
Really cool. It was great to see my friends, and I really love my teachers.
I'm so happy to hear that. I'm sorry I wasn't there for your first day, but I'll be back from Corozal next week.
It's okay, Dad. I can't wait to see you. Oh, and please remember, I still have some books I need to purchase.
Ah, yes. Let me e-cash you that right now. Money has been sent. I add a little extra cash just for you.
Whoa, Dad. Thanks. Got it.
You're welcome, sir.
Download the eCash app today and take your first step into a cashless lifestyle. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257. eCash, the future is here.
Bundle the fastest, most reliable, unlimited broadband in Belize with your prepaid or postpaid mobile plan or Netflix. You can bundle your broadband with your prepaid and enjoy 50% off all national calls, plus get SMS and data. Paid plans? Then bundle with any speed and pay only $25 extra monthly to enjoy unlimited smart-to-smart calls, plus 500 minutes, plus 6,300 megabytes of data. Stream unlimited HD movies and TV shows with our broadband, plus the Netflix add-on for only $30 monthly, and enjoy streaming on your laptop, TV, phone, or tablet. Visit a smart showroom near you to sign up or upgrade to the bundle that's right for you. Smart, bringing people together.
We're back just like that. We've come to the end of our show for today. We had an extended conversation with Dr. Musa and Dr. Hidalgo as they break down for us the insight of these variants that are in our country. We've got 4 of them now, and they were telling us all about what to do, what not to do to not contract this virus. How we could go ahead and live our life with making sure that we adhere to these social distancing protocols, social protocols, to not get infected with these variants.
Well, I want to say a big thank you to Dr. Hidalgo and Dr. Musa for joining us this morning, because when the release came out yesterday, we knew one thing, that people would have a lot of questions. And we thank you for sharing, for sending in those questions. We hope that we were able to address. I think we got through most of them, but the point is that we need to keep on informing ourselves as much as possible. Inform ourselves as to what it means with the development and detection of these new variants, educate ourselves on what our risks are, and of course, how to maneuver ourselves in the middle of this pandemic. It definitely is not over, and we have to keep on doing our parts. I think there were very sobering comments made this morning by both doctors, looking at the ages that are being affected, looking at the rapid way it spreads, and also the rapid progression of the illness itself, looking at younger populations being affected.
And losing lives. So all of these things, they gave us an insight as to what's going on at this particular point. But we want for you to adhere to the social distancing protocols, like we mentioned, where all these protocols set in place by the Ministry of Health. And also, please, get vaccinated, all right? And we also want to say a big thank you to Kalia Nunez. There's a competition going on right now. It's the first of its kind, the first back-to-school art competition for special needs students. It actually got started yesterday, and it will conclude on next week, Tuesday, which is the 17th. And we hope we get a chance to see what the winning poster is going to be like. Thank you so very much. And of course, to you. Without you, this is not possible. We're so grateful that you're able to open your eyes and starting your morning right with us. If you've got any questions, any concerns, drop us a line at oye@channel5belize.com.
And of course, you can find us on Facebook at Open Your Eyes BZ and on Instagram at OYEBelize. And remember to tune in tomorrow morning at 6:30 when you open your eyes.
To start your morning right. As per usual, keep your eyes, your minds,
and your hearts open. We'll see you soon. Enjoy your day.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.